Hi, I'm Caitlin,
And I'm Madison.
and we did our case study on avoidant personality disorder in our patient Elsa.
So, Elsa is a 21-year-old female. She is single and she is Caucasian. Elsa's country of origin is Arendelle, where her occupation is monarch or queen. And Elsa is of a high socioeconomic status and she's considered upper class.
Next, we will be discussing Elsa's personal history, including the onset of problems, as well as the severity and duration of related impairments.
Elsa began to exhibit excessive introversion and self-isolating tendencies after the age of 8. When Elsa was 8 years old, she was playing with her sister Anna but lost control of her magical ice powers and accidentally froze Anna's head. Fortunately, Anna was healed by the forest trolls and all memories of Elsa's powers were wiped. This event caused Elsa to become fearful that she would hurt her loved ones, so she drew away from social interaction to keep her emerging powers a secret and to protect Anna from further harm.
After the incident, Elsa became distant and ignored every attempt Anna made to connect with her. The severity of her self-isolating behavior significantly increased immediately after the incident and then plateaued, and up until early adulthood, Elsa did not leave the palace once and remained locked in her room. Since Elsa spent 13 years cut off from social interaction, her condition can be considered chronic and stable during this period. After her powers were exposed at her coronation ceremony, Elsa experienced an acute increase in severity of symptoms, and she ran away from Arendelle to isolate in an ice palace.
Elsa experiences impairments in the following areas of function. Elsa exhibits extreme social inhibition as evidenced by her self-isolating tendencies. This leads to limited social relationships and loneliness. Some personal factors that affect her level of functioning includes hypersensitivity to criticism and feelings of social ineptitude. In terms of behavior, Elsa avoids occupational responsibilities involving social interaction, such as interacting with delegates from other countries as Queen of Arendelle, and she's also reluctant to engage in new activities.
Elsa's behaviors reflect the DSM-5 criteria for a variety of diagnoses, including schizotypal personality disorder, social anxiety disorder, generalized anxiety disorder, and depression. Since Elsa does not enjoy her aloneness and craves close relationships, the diagnosis of schizotypal personality disorder was ruled out. Elsa experiences symptoms of social anxiety disorder, including fear of scrutiny by others during social situations, preoccupation with negative evaluation, and avoidance of social situations that cause clinical impairment. However, she exhibits higher levels of social dysfunction and distress than those present in social anxiety disorder, so this diagnosis can be ruled out. Generalized anxiety disorder is not an adequate diagnosis because her anxiety is not related to a variety of situations and contexts. Despite feelings of acute loneliness, painful self-consciousness during social situations, and intense criticism, avoidant personality disorder is a more appropriate diagnosis than depression. The criteria for the DSM-5 diagnosis of avoidant personality disorder involves a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation, beginning by early adulthood and present in a variety of contexts. The diagnosis of avoidant personality disorder thus best explains Elsa's symptoms.
Next, we'll be moving into the origin and maintenance of Elsa's avoidant personality disorder.
In adopting the biopsychosocial approach, the diathesis stress model appears to be the best explanation for the origin of pathology. The diathesis stress model posits that psychopathology results from stress experienced by an individual who has a biological, psychosocial, and social-cultural disposition to developing this disorder. In the case of avoidant personality disorder, it appears that stress and genetic vulnerability interact to produce symptoms. The inhibited traits that characterize avoidant personality disorder, such as neuroticism and introversion, show a modest genetic influence. Genetic predisposition for an inhibited temperament may serve as the diathesis that results in avoidant personality disorder when the individual experiences sufficient stress in the form of rejection or humiliation. In Elsa's case, the acute stress, regret, and humiliation resulting from freezing her sister likely interacted with her genetic predisposition.
The following biopsychosocial factors interact with each other to contribute to the development and maintenance of the disorder. In addition to genetic susceptibilities, psychological and sociocultural factors that contribute to the development of avoidant personality disorder include poor coping skills and low self-esteem regarding managing her powers, criticism and negative evaluation from family members, and feeling the need to hide her powers as a result of opposing cultural norms.
Personal psychological factors help maintain Elsa's avoidant personality disorder. Elsa's fear of social interactions and poor self-esteem prevent her from forming close relationships, and in cyclical fashion, her lack of meaningful relationships exacerbates this fear and lack of self-esteem. Fear of social interactions leads to fewer and poorer quality relationships, which perpetuates self-isolating tendencies and loneliness. When Elsa does attempt to engage in social situations, such as during her coronation ceremony, she loses control over her powers, resulting in criticism and negative evaluation by others, who perceive her powers to be dangerous and culturally deviant. This not only maintains but worsens Elsa's symptoms, and she further isolates herself by retreating to her ice palace. Overall, it seems that Elsa's avoidant personality disorder originated from the interaction of biopsychosocial factors, but is maintained primarily through psychological and sociocultural factors.
So as you can see, Elsa continues to maintain her avoidant personality disorder by further retreating further away from social contact and going into the mountains to build an ice palace. Whoops.
Based on Elsa's personal history, support, and financial means, recommended treatment for her diagnosis of avoidant personality disorder includes family therapy, CBT, and medications.
Research studies conducted in the Netherlands have revealed that short inpatient therapeutic treatment is more effective for cluster C personality disorders, including avoidant personality disorder, than outpatient treatment. Patients may receive a shorter duration but greater intensity of therapy while living in a facility to experience maximum benefits. Therapies that have shown to be effective for avoidant personality disorder and would be feasible for Elsa's treatment plan include cognitive behavioral therapy and family therapy. Through cognitive behavioral therapy, Elsa can learn to challenge dysfunctional feelings and behaviors, such as perceived social inadequacy, low self-esteem, and avoidance of social situations. Elsa's therapist may ask her to keep a log to monitor dysfunctional automatic beliefs, challenge faulty logic, and engage in behavioral tasks, such as participating in one new social experience each week to aid in her recovery. However, since Elsa tends to be hypersensitive to criticism, her therapist should be careful not to come across this way. Elsa would also be a great candidate for family therapy, especially since her sister Anna provides such a strong source of support. Anna's presence during CBT sessions can help to reintroduce social participation in addition to ensuring that Elsa practices these techniques outside of session.
Medications used to treat avoidant personality disorder primarily consist of antidepressants. MAOIs and SSRIs, classic drugs, have shown to be effective in treating both avoidant personality disorder and anxiety. Due to Elsa's high socioeconomic status, both medication and therapy are financially feasible treatment options. However, since Elsa is Queen of Arendelle, she may not have enough time to commit to long-term therapy, which provides further support for brief inpatient treatment instead of outpatient therapy. Finally, Anna would be willing and able to participate in family therapy.
Throughout this presentation, we referenced our textbook. Thanks for listening.